Hello and welcome back to my channel, Simply Health PhD. I'm Bethany and today I'm going to be talking to you all about the biopsychosocial model. But first, for those of you who are new to my channel, welcome. I'm Bethany and this is my platform where I share with you health education and advice. So if you're new and interested, please don't forget to subscribe and hit that notification button to stay updated. Okay, so what is the biopsychosocial model? Well, simply put, biological, psychological and social aspects of health and well-being or disease and illness. So when we think about it, what is health? How do we define health? So, I mean, most people would say it's the absence of illness and disease, but as time's gone on, we know that it's much more than just being free of illness. So in health psychology, it kind of looks at what actually causes the illness. Now, in a traditional biomedical model, we would look at perhaps disease itself and the disease process and treat it with a physical cure. But when we look at the whole picture, we can actually see that health and illness is caused by a multitude of factors. And in health psychology, this is known as the biopsychosocial model. So simply put, the bio stands for genetics, viruses, bacteria, lesions, things like that, things that directly affect your physiology. The psycho aspect stands for your cognitions, so that might be your attitudes, your beliefs, your emotions, your personality, and the behaviours that you carry out. And obviously the social aspect incorporates things like social norms, values, your class and your ethnicity. So if we apply this to an everyday scenario, we can say we have a patient and he's just been diagnosed with high blood pressure. Now typically the GP would put him on beta blockers to help manage and control his blood pressure to prevent it going up anymore. But if we take a step back and look at what other factors might be causing it, we can see perhaps that this patient is in an ethnic minority group and has a lower socioeconomic status. Now, unfortunately, a lot of research has shown that people with a lower socioeconomic status are more likely to suffer with illness and disease, as opposed to people who are a bit better off, a bit wealthier, and are in a bit higher class. So let's say that this patient has been treated with the beta blockers and told by the GP to take up better lifestyle habits, start going to the gym and eating a little bit better. But if we look at his whole picture, the whole picture of his health, we can see that perhaps his family and the people that he's surrounded by don't take health so seriously. Perhaps they drink, they smoke, they don't really like exercising, and they're not very interested in their health. So our patient here is very unlikely to adopt a health behaviour if everyone around him isn't or doesn't value that very highly. Then we can move on to the psychological factors, so how he appraises this situation. What does he think of high blood pressure? Perhaps he thinks, oh, the medication's enough to manage it and therefore I don't need to do anything else. Perhaps he isn't too worried about the high blood pressure. Maybe his personality will play a role in whether or not he chooses to adopt new healthy behaviours in order to manage his blood pressure. And so we can see there's like transactional relationships that influence the factors causing the high blood pressure and also preventing him from changing and helping himself. So that's just a very short and brief example of what the biopsychosocial model is within health psychology. Now, I like to view health myself as a bigger picture, a multitude of factors that influence it. So I've done a lovely little illustration here. And I talked a little bit about this on my Instagram, if any of you follow me, at simplyhealth.phd. And basically, with this image, what I am trying to say is that health is a complete multitude of factors, and without all of them being perfectly in balance, we're likely to find problems in other areas and see things starting to go wrong with other factors that incorporate our overall health. So here you can see I've incorporated social and environmental factors. Now here, When I talk about social, I'm talking about your relationships, the support that you have, your social networks, the people that you surround yourself with, their norms, their values, things that are going to have a direct influence on you and your well-being, your support networks. Alongside this, we have our environmental factors, so things like our living conditions, our circumstances, perhaps our jobs, our class, and again this clashes with social as well. Where we're living, for example, people living in London are much more exposed to air pollutants than people living out in the country, so things like that have a real impact on our health and well-being. Do you live in a busy area that's very stressful? Like, I can imagine commuting in London every day compared to someone who perhaps lives in the country and works from home, who is going to have a much more relaxed kind of way of life. We then look at diet and exercise, your lifestyle factors. Are you eating a varied and nutritious diet that's supporting your body's health needs? Are you exercising and living actively, or are you just spending 8 hours a day sitting at a desk and then going home and sitting on the sofa to watch TV? And as we all know, and I think these are kind of the biggest things in what we view as health and view as attempting to get healthy, is our diet and exercise. And these are really, really big components of health, but they're not the only components. So there's no good you being really fit and active and eating a brilliant diet if you have a really poor social relationships, are living in awful conditions, and your mind's not well. And then we can look at the mental aspects of it, the psychological factors. So how are your emotions? How do you think about things? What is your current mental state? Are you looking at things positively? Are you looking at things negatively? And this also ties in with our subjective well-being, or SWB. Now, this is kind of your happiness, your overall happiness, how you feel about things, what your perception of life is. So when we try and define well-being, a lot of time happiness kind of comes into play here. So how is your happiness, overall life? How is your life satisfaction? Are you doing things that you love to do, or are you sitting in a dead-end job that you absolutely hate? Are you living your life to how you want it to be? How are your emotions? How are your moods, like long term? And these are all massive components and factors that influence your overall health. So whether you're a healthcare professional, a medic, a therapist, a personal trainer, whenever you're working with your patients or your clients, think about how all these different factors can be influencing their current health and well-being. And rather than just focusing on your field or your niche, think about everything else that's coming into play here that could also help them and perhaps is being a hinder to their health. So I hope this video has been useful to you. I hope you've learned a little bit about the biopsychosocial model and health psychology, and I hope it's given you something to think about, something perhaps challenge your perceptions on what health is, health and well-being really is. If you like this video and would like to see more content, health education and advice videos, then please support me by hitting that notification button, so liking and subscribing. And you can also find me on Instagram at simplyhealth.phd. Thank you for watching. See you soon.